example of that is the tuberculosis. Enteric transmission is oral fecal transmission. The organisms are found in the feces and are ingested by susceptible victims, often through cross-contaminated food due to poor hygiene of hands. A good example of that is the salmonella. All the Hep A outbreaks that we've had with the spinach and the green onions, it all had to do with poor hygiene. And if you think about it, the farm workers, how many times do you see a porta-john out there on a field? Do you see a porta-john out on a field? So they have some kind of way to wash their hands. So it is a consumer's responsibility to wash their vegetables. It's not the packaging company's responsibility. So make sure that you wash your veggies. Vector-borne transmissions is an intermediate carrier, which is the vector, such as flea or mosquito. It transfers the infections to the other organism. And mosquitoes, you know, can transfer organisms to deer, to raccoons, to any, you know, any kind of wildlife out there.
Does a vector have to be an animal? Can it be like a container? You know how there's been bioterrorism?
Yes.
Would a box of something that explodes, would that be considered a vector?
Vectors are normally more like what we call arthropods, insects. That's really what the term vector is. So what you're talking about, that would be more like a transmission. I don't really know the correct term that they would use for that.
I just know where.
But right, like an envelope sealed with ricin or
a
anthrax.
person being purposely infected with a disease and then somehow go into, I'm thinking about movies and TV
Yeah,
programs.
scary.
Sorry.
Contagion. Yes, yeah.
Yeah, I can explain that to you later.
Microorganisms in the infection cycle, 5 elements. There's the reservoir. It's microorganisms require a place where they can grow and reproduce. It's a host or a reservoir. Examples are animals and humans. So every bug needs to have a place to grow, basically. Okay. Microorganisms have an exit area too. It's a means to leaving the host, and it can exit through any of your orifices: nose, mouth, throat, ear, eye, intestinal tract, either the urinary tract, rectum, or vagina, and break in skin, such as the tubes or the lines. Okay. Portal of exit bodily fluids are the sputum, the emesis, blood, urine, wound drainage, and genital secretions. This is the right one. So sputum, many of our patients are ill and have bacterial, so that would be one thing to watch out for. I once had I don't know if I should tell this story or not.
Sure.
I had a brain injury, I should say, a person that had a brain injury. He was also a Vietnam War vet. He was very down to earth and very, you know, uncouth, okay? With having the brain injury, his inhibitions were not the best, okay? So he had to have a trachea, and they normally kept it covered, but he came this day without it covered. And he coughed, and the biggest piece of sputum come out of there and just flung out across onto the table.
Yep.
So you know, my point is, you know, it does have disease in it. Emesis, blood, urine. In the urine, guys, there's what we call a VRE, vancomycin resistant enterococci. It's very, very contagious, and it's very resistant to antibiotics. So Typically, you just see that in hospital settings, but it's something to be aware of.
And also, I was thinking about how it's important to finish all your antibiotics, you know, and how that plays a role in
Yes.
some of the stuff.
Yeah,
and not
it
just
absolutely does.
use antibiotics that were prescribed for something else, you know what I mean? And
Right, right, if your
Because
sister gives you antibiotics because you're not feeling good, we don't really always know that it's a bacterial.
Right.
Antibiotics do not work on viruses, it has to be a bacterial infection for them to work, so that's a good point too. Transmission, microorganisms must pass from one person to another to spread the infection. Really, transmission can be not just from person to person, it can be from the water, it can be from the food, it can be from the vectors, and through air droplets in contact with skin. Entry into a new organism, it can be a cut, it can be a hangnail, it can be a little abrasion, any little paper cut, scrape, any kind of little opening into the skin. Yeah,
The eyes.
the eyes.
Yeah.
Mhm, yeah. Yes, ma'am.
When I was in upstate New York, a nail salon got closed down because they transmitted herpes to somebody's hands.
Really?
Yeah, because they break in the cuticle.
Wow.
So do pores count in the house?
What's that?
Do pores count as that? I mean, is that an open?
Well,
You can't help that.
pores can be an opening for some worms.
Pores.
Like they can come through your hair follicles. Susception is a susceptible host. If the body defense mechanisms are unable to withstand the invasion of pathogens. Progress of an infection, you have your incubation period, you have your prodromal period. That means like the lasting period. Prodromal means how long it lasts. You have the acute phase of illness, the convalescence period, and the communicable period. So for the incubation period, it's the time between entrance of pathogen and the appearance of symptoms. Prodromal period is non-specific symptoms such as nausea, fever, general weakness, aches, and pains. Sorry, I misspoke there. Progression of an infection, acute phase of illness, it may be a cluster of symptoms. Specific symptoms appear. Lab analysis can identify the infection. And includes periods in which symptoms subside. Do you have to write there? No. Okay. Something that's interesting about lab analysis is they actually do DNA on bacteria. Bacteria has its own DNA. And that's how a lot of the food outbreaks that you hear on, on the news and the radio, that's how they can identify where this outbreak got their meat or got the vegetables or wherever. Just a little side note. Progress of an infection is the convalescence period. It's where the antibodies begin to be present in the blood. Communicable period or communicable disease, it's contagious disease and it can be latent. Then we have our nosocomial infections. It's associated with healthcare delivery, hospital acquired. Your risk factors are the environment, the therapeutic regime, and the client's resistance. One note that I do want to bring up here is that MRSA used to only be in the hospitals, but now it's not. It's what they call a community-acquired disease as well. So You may see MRSA, methicillin resistant, Staphylococcus aureus, MRSA, and then you can see a CA in front of it, that means community acquired. So like, isn't Bucks, aren't the
Yeah.
Tampa Bay Bucks, don't they
Yeah.
have so that would be like a CA, MRSA.
It's really bad at Peace River Hospital too.
What hospital?
Peace River,
Oh,
I had someone that went there and then they gave her a special soap and like they said all the patients had it because it's been so hot lately and that's like how it spreads, I guess. So they made her wash with like special soap.
oh.
Yeah, it's weird.
Asepsis is the absence of microorganism that produce disease. Prevention of infection by maintaining a sterile environment and to make free from disease-producing organisms. So that would be like a surgical room, right? Or sterile gloves that come packaged, or anything that kind of comes packaged in a container. Like your saline is a sterile product. For wound care, you'll see the little saline, they're like little pink tubes. Practices that help to reduce the number of spread of microorganisms. There's a clean technique to reduce the number of pathogenic organisms. Practices may include hand washing, gowning, gloving, and disinfection. For surgical asepsis, practices keep objects and area free of all microorganism. Who requires sterile techniques? Are clients with burns, right? Because our skin is it's an organ that protects our inner body, protects us from getting infection, actually. Premature infants, because they can't regulate their body temperature. Transplant recipients and clients receiving chemo and radiation, because their immune systems are down, right? Prevention of transmission of infectious disease, comprehensive immunizations, drug prophylaxis, improved nutrition, living conditions, safe drinking water and sanitation, correction of environmental factors. Is this a right down one?
Yes.
So immunizations is very controversial right now with parents and their children. Probably one of the most controversial immunization is the HPV, where it is recommended that young girls and young boys get HPV vaccine to prevent
Papilloma, right?
Yeah.
Papillomavirus, yes. And really the purpose of that vaccine is to prevent cancer later on in life. But they have to have it before sexual activity. So that's why the age is so young.
So do they know for a fact that it's not gonna cause problems later for a young girl when she wants to try to have children? So it's like there's like a there's pro and cons to
Right,
it,
right.
you know, but it's not